Hi, this is Dr. A. Ganesh Raja, and this presentation is about first degree heart block. Though the term indicates heart block, the block is actually in the AV node. Hence, this should be aptly called as AV nodal disease, AV nodal block. Okay, this is classified into 3 degrees: first degree, second degree, and third degree, of which we will be dealing with only the first degree in this presentation. Heart block, as we have said before, is equal to AV nodal block because the block occurs only in the AV node. It is seen in oleander seed poisoning because oleander seed poisoning is the most common poison in our part of country, and this can block the AV node, and digoxin toxicity and inferior MI because inferior MI, the AV node is supplied by right coronary artery, hence inferior MI most commonly produces AV nodal block. We all know that the PR interval is 3 to 5 millimeter. To remember, this is P wave, this is QRS complex and T wave. The term PR interval starts from the starting of P to starting of QRS complex. Just it includes the P wave. This normally will be 3 to 5 millimeter. When it is more than 5 millimeter, it indicates the patient has AV nodal block. This is very simple to diagnose in an ECG. The common causes are athletes, because athletes will have increased vagal tone. A vagal tone can suppress your AV node, can produce your AV nodal block. And the other drugs like ABCD, amiodarone, beta blockers, calcium channel blockers, and digoxin. Kindly note that not all calcium channel blockers blocks the AV node. It is only the rate limiting calcium channel blockers in the form of verapamil and diltiazem, and inferior MI and myocarditis seen with Lyme's disease, Lyme's myocarditis. First degree interval, the PR interval is prolonged, that is it will be more than 5 millimeter, but it will be fixed, that is almost all the PR interval will be of the same duration, and all P waves will be followed by a QRS complex. So all P wave will have a QRS complex. So in short, this can be called as slowed conduction rather than a block, because block literally means that something is blocked from going to the opposite side, but here almost all the P waves are conducted, hence this should be called as slowed conduction rather than a heart block. In this ECG you can see the PR interval. This is the P wave, QRS complex, and T wave. P wave starts here and the QRS starts here. More or less it comes to 7 millimeter. Also you can see in the next beat also it comes more or less to 7 millimeter. So the PR interval is prolonged and it's also fixed. So this is a classical example of first degree heart block. Thank you.